If you are 65 or older and not vaccinated for the flu, you're playing a dangerous game with your health. Hi, I'm Dr. Kathy. As we age, the risk of complications of the flu dramatically increase because of changes in the immune system, the immune defenses, and baseline health. For people who are 65 or older, getting the flu increases your risk of heart attack by 3 to 5 times and increases your risk of stroke by 2 to 3 times, both in the first 2 weeks after getting the flu, and that elevated risk stays with you for months. There is 6 times risk of dying from the flu and its complications when we are 65 or older, and 70 to 85% of all seasonal flu deaths occur in people 65 or older. Of hospitalizations for people who have the flu, 50 to 75% are in people 65 or older. Those are shocking statistics. Patients who have other medical problems such as asthma, diabetes, chronic lung disease, and that's my plug for stopping smoking no matter what your age is. People who have chronic kidney disease, heart disease, or history of stroke have increased risk of flu complications, and add that to the risk of being 65 or older, and your risk is even higher. Can there be some side effects of getting the flu vaccine? And the answer is yes, we all know that. There can be injection site pain, redness, generalized muscle ache, and generalized tiredness for 1 to 3 days after getting the flu vaccine. There can be allergies. There can be allergies to any medication that you put in your body. Those are side effects. That's different than complication. The flu can have minor complications, but most likely in somebody 65 or older, the complications are going to be major. So for minor complications of the flu, it can be sinus infection or ear infection. But for serious complications of the flu, there is a long list. It can include pneumonia, which is infection in your lungs, myocarditis, which is inflammation of your heart muscle, encephalitis, which is inflammation of the brain, myositis, which can be inflammation of your muscles, something called rhabdomyolysis, which is breakdown of muscle tissue throughout the body, multi-organ failure, that means your lungs don't work, your kidneys don't work, other organs don't work, requires a ventilator, dialysis. And lastly, for me to give you of the long list, is sepsis, which is infection in your body, in your bloodstream, requiring multiple antibiotics, which can also lead to multi-organ failure that we just discussed. But there is very good news. If you got the flu vaccine and you still get the flu, there is decreased chance of death and much less severe disease if you got the vaccine. In 5 observational studies of adults with flu-associated hospitalization, that means you were so sick with the flu you had to be admitted to the hospital, who also had the flu vaccine, there was 31% less chance of dying from the flu. Did you get that? If you get the flu and already had gotten the flu vaccine, you decrease your chance of death by 1/3. In 8 studies of adults with, again, being hospitalized for the flu who also had the vaccine, there was 26% less chance of going to the ICU. That's the intensive care unit. You can imagine how sick you would have to be to go to an intensive care unit. Among people who have cardiovascular disease, maybe calcium deposits, plaques in your vessels, heart attack, stroke history, people with that who got the vaccine, it's associated with decreased risk of death and major adverse cardiovascular events, which we mean by that heart attack, stroke. In 2022, there was a meta-analysis. What that is it's looking at a combination of multiple studies. In 6 randomized trials of 9,000 patients who got the flu vaccine, there was a 34% decrease in, again, cardiovascular events, heart attack, stroke. Lastly, for all these numbers, for all these statistics, in 2022, a meta-analysis of 237,000 patients with cardiovascular disease vaccine gave them 18% decrease in cardiovascular death and 13% decrease in major adverse cardiovascular events. Again, heart attack, stroke. So what all this adds up to is this. You shouldn't be taking a chance with your health. This is urgent. And unless your doctor has a medical reason for telling you not to get it, please get the flu vaccine as soon as possible. Your health isn't too important to put off. And along with that, you should watch the video that's appearing on your screen now, where I give 4 tips to slow aging. I think you'll like that one too.